We have a question about vitamin B2. So vitamin D2 is riboflavin. And riboflavin was discovered many, many years ago to actually be possible to use to create and catalyze a reaction between riboflavin and ultraviolet light and corneal tissue, that if you saturate a cornea, the corneal tissue, the keratocytes, with riboflavin and actually then shine a particular fluence and wavelength of ultraviolet light, kind of similar to what you get in sunlight in some ways, you can actually catalyze a reaction that creates extra bonds or more bonds in between the corneal cells, increasing the rigidity or the strength of the cornea. And that, of course, doesn't go all the way through the cornea. It goes to a certain depth that the penetration of that strengthening occurs, depending on whether it's epi on and epi off, but that's a separate discussion. But it was riboflavin that actually was able to catalyze this reaction, okay? And that was the important breakthrough many, many years ago. And the keratoconus treatment is based on the fact that we can catalyze a reaction to increase bond between keratocytes or corneal cells, okay? Because the basis of an ectasia like keratoconus is there's a weakness that the cornea actually bulges forward because there's a weakness, and we directly strengthen that weakness.